Are your patients happy? Are you getting paid? Hey, that's important, right? In 2027, at least 80% of electronic prior authorization approvals will be answered in real time. Automation, utilization of AI is critical to our industry's survival. It's time for a rate refresh to keep up with the current market environment.
This is a conversation series about the people shaping the future of healthcare. These are the leaders who see opportunity where others see obstacles. Each episode highlights experts that understand the complexity of healthcare but choose to act with clarity, purpose, and optimism. We call ourselves co-conspirators because we aren't sitting around waiting for change. We are driving it. Welcome to the co-conspirator track.
For those who may not be familiar with AA Home Care, which I imagine are very few, but can you give a quick overview of your organization and just your role at AA?
Absolutely. And Caleb, thanks for having me on. I work with the American Association for Home Care. AA Home Care is the national nonprofit trade association representing durable medical equipment suppliers, manufacturers, and distributors. So we are 100% advocacy focused. We have a team dedicated to federal legislative initiatives, a regulatory team dialed into CMS and Medicare fee-for-service programs and policies, a top-notch branding and communications team, and last but not least, our payer relations team. So I'm Vice President of Payer Relations. I work with the legendary Laura Williard and our newest team member, Katie McConigal, who joined us earlier this month. So we're really excited to have her join our payer relations team at AA Home Care. So payer relations, we focus on state initiatives, often in collaboration with our state and regional association partners, and that would include state legislation and Medicaid reform. We also focus on commercial payers, TRICARE, and Medicare Advantage. So it may be easier just to say we do everything other than federal legislative and Medicare fee-for-service tasks.
Well, thank you for that overview. It's great to have you on, David. And yeah, we love to hear your perspective on a lot of kind of shifting stuff in the industry. And so you guys just had a spring legislative conference. So what policy or payer reforms are showing the most traction, and what's building and then what's stalling? Can you give us a lay of the land right now?
Yeah, so the spring legislative conference was really busy this year. We had a lot of topics and issues to speak with legislators about. Of course, we have our 7525 legislation, HR 2005, and the carbon fiber titanium wheelchair upgrade legislation, Senate Bill 247 and House Bill 1703. The new NIV, NCD, our national coverage determination, obviously concerns with tariffs, the future of Medicaid, among other issues. So while the federal legislative efforts are still active and we are still seeking support, call your member of Congress, but we also have since seen some new changes as well. There's the new proposed rule from CMS reintroducing competitive bidding, making changes to certain product categories and modifying the accreditation program. So the proposed rule may be another full episode on your podcast by itself, but I think it's worth mentioning that any changes to Medicare fee-for-service could also have impacts to Medicare Advantage, TRICARE, commercial, and Medicaid in many cases. We've also seen Trump's One Big Beautiful Bill Act, which was signed into law July 4th. According to the CBO, it includes over $1 trillion in spending reductions to Medicaid programs over the next decade. It's expected to result in up to 10 million people losing coverage by 2034. Some of the key challenges are implementing work requirements, where those under 65 have to work, train, or volunteer at least 80 hours a month in order to keep their Medicaid benefit. changes to provider taxes, so stricter state financing rules, which means states can't use provider taxes to fund their share of Medicaid. More frequent eligibility checks instead of an annual Medicaid eligibility check for enrollees. It would be every 6 months. Caps to state-directed payments, and while these changes may not directly impact DME reimbursement rates, the changes will likely cause state budget shortfalls, and when states look to offset those costs by reducing services, reducing provider reimbursement, or some combination of both. So we believe that those impacts will vary by state, and thus the importance of our message around rate stability and that mission.
So what is something you think providers can do to prepare for that potential impact? Like you said, it may not have much impact at all, or may have great impact depending on how the state legislation responds there. But how can they prepare? Do you think there's anything they can do, or how can they position themselves for success through this new big beautiful bill?
Yeah, there's always something to do. From an advocacy perspective, make sure you know your state representative, your state senator. Make sure they know what you do, what services you provide, the value that you bring to the healthcare continuum. Make sure they're educated and they understand that we're not just, drop shipping something to someone's doorstep. There's a service component. There's certain requirements and that insurance is put in place to make sure that items and services are medically necessary that have to be met. All these things have a cost. So we have to make sure that access is maintained. And that starts with education and making sure that your legislator knows what it is you do and what all goes into providing service to keep folks in the home.
Let's shift a little bit to the payer side of things. And really they're shifting, they're narrowing their networks, they're embracing new tech. And so what's your perspective on this? How is this going to change the industry?
I believe that the trend is here and cannot be ignored. A lot of these models are regional or still in test markets. So I would first suggest working with a home care and your local state association. And in doing so, I would take the time to consider 3 important things. First, look at the big picture. How will this model impact your service area, your community? What does this mean for the future of our industry and your business in particular? If the model is successful, or even if it fails, how's that going to impact you? Do you believe that the model is sustainable, or is it destined to fail? We've seen some models in the past that haven't tested or made the test of time. So this, is somewhat opinions, but it's important to consider these points and not fall for some of the scare tactics that you may hear from payers that can often be misleading. Next, I would make sure you read the small print. It seems obvious, as with any contract, read the small print. But this is especially important in healthcare. Are both parties' expectations outlined in the contract? Is everything that's being promised verbally outlined in writing? Is the contract one-sided? What recourse is available if certain expectations are not met? But you have to start by reading those contracts and understanding and asking questions. And then finally, and maybe this is the most important, is to network. Talk with your colleagues with experience in working with these models. Ask questions. What are the pros and cons? Has it improved efficiency within their organization? Are your patients happy? Are you getting paid? Hey, that's important, right? And, a great place to do that is at MedTrade or at your local state association conference. It's a great place to network. And I want to take a moment to encourage everyone to attend MedTrade next year. It's going to be in Phoenix. It's the first week of March, so hopefully it won't be too hot yet, but definitely sign up. This will be a hot topic for sure at MedTrade.
Can I talk a little bit how you guys can help with this relationship with payers and with this kind of potentially new trend coming up in the industry?
Yeah, just to get information, to get intel. Maybe you can join one of our councils, talk with other like-minded businesses and leaders in our industry. We can give you some background on some of these models. So we have a payer relations council and a subgroup within that council that's looked at different models that are available to the industry. So we have done some evaluation. We may be able to share some of that information with you or talk through what the best option is for you. And if that exists, but what next steps are available for you.
You mentioned state associations and conferences, but it's starting in August, right? There's a lot happening there. You have a big gauntlet approach. What issues do you see that are coming up that you guys are going to be talking about? And what do you think are some opportunities for dialogue that will happen at these associations?
Caleb, you're right. It is a gauntlet of state coming up in the fall.
It's a lot. I know it's a lot.
I'll be presenting in several of them, and topics will focus on the latest trends in payer relations, and I expect a lot of those will be around prior authorization reform, Medicare Advantage, and of course, Medicaid changes. One example is the recent pledge from top health plans representing 75% of covered lives in our country. I thought it was encouraging to see that pledge be put forward. If successful, it could open the door for more efficiencies and streamlined prior authorization processes. They're pledging certain changes around standardizing electronic prior authorization, ensuring continuity of care when patients change plans, enhancing communication and transparency on those determinations, standardizing some of those reasons for denials so that they can be better trended. And this is my favorite, the real-time responses. So in 2027, at least 80% of electronic prior authorization approvals will be answered in real time. So hopefully DME is included in that 80%, but I think, that's a game changer for DME businesses to be able to get real-time responses on whether an item or service is covered, so that the patient can receive that quicker and avoid some of those costly delays that are taking place now.
Yeah, absolutely. There is very little standardization, despite what we do in the really the security that's involved with what we do and health records and all of that. Yet there is very little standardization and transferring these records and defining clean orders and all of that. And so we would be remiss not to use the term AI in a podcast these days. So where do you see AI automation in helping streamline this process and this communication and really this relationship with payers for providers? Are you seeing a trend? Are you seeing anything problematic approaching with it? What are your thoughts?
Providers are being squeezed with increased costs from all angles, right? Your labor costs, your cost of goods, your cost to ship, just general inflationary pressures across the board. And when you're dealing with fixed insurance reimbursement rates, there's nowhere to pass on those costs. So automation, utilization of AI is critical to our industry's survival. We have to become more efficient to survive. There are new players coming into the market with some really amazing tools that can benefit. Other benefits of automation include the ability to gather data and improve the customer's experience, whether the customer is the referral source or the end user. We need to make sure that the process is consistent and as seamless as possible. Also, through the automation, we'll have access to more data, right? And the more data we can provide to support and strengthen our advocacy efforts, the more likely we are to be successful. So when we're telling state legislators we need more funding in our space, it helps to show the ROI or the value of that investment, improve patient satisfaction, lower readmissions, fewer ER visits. We can tie those into additional DME investment. It's a golden ticket. So, I always like to double down on, just investing in home medical equipment. Will save the overall healthcare system because care in the home is the most cost-effective setting. And nobody really disputes or disagrees with that, but having more data to quantify that value and drive that message home is really going to be key.
Yeah, absolutely. Well, as an automation company, we couldn't agree more. It's a little biased. We completely agree and just yeah, when especially when they're cutting funding and limiting things, that the only thing you can do is just be more efficient. There's no other costs to be increased. There's no the things how much we pay people just keeps going up, and how much things cost keep going up. Right? There's nothing we can do about that. So we can just become better. As you approach, you said you're gonna be speaking a lot on various things. Where do you think, y'all's voice as an association, where's your main focus on impact, and what do you think is going to help the most right now? Or I guess what's the message as you guys approach this gauntlet?
So right now we're really focused on rate stability with all payers. Now, I do believe and completely agree there's room to improve efficiencies and take strides in reducing those overhead costs through automation and AI. But when reimbursement rates have remained stagnant for decades with some states and payers, it's time for a rate refresh to keep up with the current market environment. Suppliers are under tremendous cost pressures. I know I mentioned that already, but it's true. And we need to ensure people have access to quality home care and home medical equipment. And that's the key voice with changes coming down from the federal government, and certainly what we expect to see in states moving forward. So I'll step off my soapbox there, but
well, that's what the podcast is for. That we need the soapboxes. So please, yeah.
Yeah. And then, in addition to that, I think, as I mentioned earlier, find ways to capture and collect more data that demonstrates our value. We know the value's there, but healthcare is a data-driven industry, and we need to quantify our value to strengthen our advocacy. So I'd like to see, some more solutions out there that address those payer pain points and ensure seamless access to care. And with AA Home Care's growing list of technology-focused partners like Valier, I believe there's a great opportunity to find some of those solutions and get them out there to benefit everyone.
As we close, David, I'd really like to hear just from you personally. What are you most focused on right now? Is there something a topic or something that you're working on that just what gets you up out of bed every morning? What gets you pumped up and you're ready to tackle the day?
Yeah, Caleb, it's the rate stability. It's providers are having to close their door because they can't keep up with the cost pressures. And these are industry friends. These are people I've known for decades who are having trouble meeting payroll because reimbursement is stagnant, in some cases even going down. We've got to step up and find ways to communicate our value and make sure that our industry has a sustainable reimbursement model that can ensure that the access to the valuable services and equipment that we provide remain in place, because otherwise people are readmitted to hospitals or admitted to more costly institutional care settings, and we are part of the solution to save healthcare dollars. And that's what gets me up in the morning. That's what gets me fired up, and that's what I spend most of my time working towards.